webinar. Taking today's webinar will be Dr. Henrietta, who is a senior faculty at Lagos Business School. She leads entrepreneurship on the MBA program and executive programs at Lagos Business School. She's currently the academic director for the owner manager program. She's also the project director for the Impact Investing Policy Initiative at Lagos Business School. Dr. Henrietta is a seasoned consultant in entrepreneurship. She has an MBA from the Lagos Business School, as well as a PhD in entrepreneurship from Lancaster University in the UK. She's a life member of Beta Gamma Sigma Group, and this group only admits high performers from the top 5% schools worldwide. So you are welcome to this webinar. I'm sure it's going to be very interactive, it's going to be enlightening, and it will be time well spent, because we are here to discuss about the impact of the COVID-19 on lives and on businesses. So thank you for joining us this morning. A bit of ground rules right now. If you would like to submit questions during the webinar, please do so in the question and answer tab given to us. Check on your tab in front of you there, you will find the Q&A. Click on it and then ask question. So thank you very much. I hand over to Dr. Henrietta. Dr. Henrietta, good morning.
Good morning, Ejiro. Welcome everyone. It's a pleasure to have you all here, and thank you for joining us. The COVID pandemic is the topic on everyone's lips at this point in time, and very much so given that it has affected millions around the world and killed more than a few hundreds of thousands. And so as Nigeria prepares to lift the lockdown, we want to know how best that can be done, especially as there's a history that, of the Spanish flu that showed that when the lockdown was first lifted, the second wave killed even more people than the first wave. Now, I think that just to backtrack a bit, I would like to start by saying that we're in for a marathon. Statistics have also shown that pandemics take at least 2 years to clear. So if using our modern technology, we're able to clear this pandemic within a shorter time, I don't think it's going to be anything shorter than a year or a year and a half. And so as Nigeria prepares to lift this pandemic, I'd like to talk about what we need to put in place so that this can happen safely, and also ensure that we don't have a repeat of what happened during the Spanish flu pandemic in 1918. So let me start by sharing with you my slides. Just give me a minute. I hope it's technology will not fail us here. For some reason it's hanging, but anyway, that's fine. So basically, one of the things from so sorry, this is hanging. Okay. Right, so the objective of this seminar is really, of this webinar, is really to show how we can live with the new reality while maintaining health, safety, and economic progress. And I wanted to start this by looking at the measures or the popular responses that have been put in place in response to this pandemic. The first is that we have had lockdowns. I'm trying to share my screen so that you can follow my follow this conversation with words. Okay, so we've done lockdowns, and then we've also talked about testing. Now, there's no country, most countries around the world are struggling with this because most countries have not been able to test adequately, but some have tested more than others. And it's something we're still struggling a lot with in Nigeria. Ghana has tested quite in Africa as a whole. South Africa has been said to be the country that has done the most testing, but even at that, they have not been able to test up to 25% of their population. Ghana, with a population of 31 million, has done quite a bit, but even at that, they are still not quite there. And Nigeria has been a bit behind these two countries. And so we have artificially low figures, even though today's figures are at about 1,500 and something, and it's still not up to par, given that we have a population of today's infection figures are at 1,500, which is still artificially low. Now, we're a population of about 200 million, and I don't think we've tested up to 500,000 people. So again, that's not quite effective. Then we've gone into building isolation centers, okay, in readiness for those who will get infected. As of today, I don't think we have a capacity for up to 10,000 people. And if you think that in Lagos alone, we're about 20 million, the question now becomes, what happens if more of us, more than, let's even say 500,000 people, which is just 500,000, fall ill? Are we prepared to take care of them adequately? Now, we've gone into improving hospital facilities, which is always a good thing to do, and we're also treating. And then we've gone into decontamination and fumigation. Now, if we want to analyze the effectiveness of these measures, we'll find that they haven't been quite effective, in the sense that lockdowns are unsustainable. We've seen how we've had traffic during lockdowns. I mean, it's a paradox that can only happen in Lagos, where you're supposed to be locked down and yet there's traffic on the streets. So, and even in America, we find that people are agitating for the lockdown to be lifted because they want to go back to business. Their bills are rising and the money is coming in. So at the end of the day, lockdowns are unsustainable. They've been effective in slowing down the rate of communication, but even at that, in many countries around the world, especially in the US and in Europe, hundreds of thousands have died. And so I don't know if we can call that really effective. In terms of testing is important, yes, but is it really conclusive? Because I could go to tests today, and while I'm waiting for my test results, I could get infected. And then if my test results come out telling me I'm negative, I could go down with a false sense of safety, and I could infect other people, because I'm so sure I'm safe that if I'm a nurse, I'm treating patients. I'm a mother, I'm treating as a mother, I'm treating my children. And as a colleague at work, I'll go around, generally working with others, and everybody has a general sense of false security. Now, building isolation centers are useful, but they're reactionary, in the sense that they are waiting for people to actually fall ill. And as I mentioned before, we're too many. I mean, compared to the capacity we have of isolation centers, there are too many of us. So rather than wait for us to fall ill, a proactive measure would be preferred. Proactive measures would be preferred. Now, in terms of improving hospital facilities, this is always a good thing to do, but it's a pity that we have to wait for this to happen to understand that we needed to have our health care facilities in place. But all the same, we're glad that that is going on. In terms of treatment, it's good, but we've also seen that the infection is possible. There are people who have recovered and have been reinfected in places like South Korea and China, and it could happen here as well. And if they say that the coronavirus is in the flu family, and we know that you can get reinfected with the flu, it's only, it shouldn't be too surprising that the coronavirus patients can also get, survivors can also get reinfected. Of course, decontamination and fumigation is always a good thing to do, but it's not foolproof. It doesn't ensure that infections don't occur. So it's preventive, but not foolproof. So the question now is, what do we do? Okay, what will work and why will it work? And that's really the crux of what I'd like to discuss today. So these are just suggestions based on looking at what's going on around the world, and people and the testimonies of survivors who have spoken about how they have become cured. So the first thing I think we need to put in place, especially before the lockdown is lifted, is one, to ensure that there is sufficient information dissemination to facilitate behavioral change. So in many, I haven't seen enough adverts in local languages, Igbo, Hausa, Yoruba, Efik, Kanuri, etc. If people don't really understand how infections happen and what they need to do to prevent infections, it's going to be difficult for them to behave differently. So in the cities, everybody seems to know, well, I think, but perhaps not in the villages, in the hinterlands, where life continues as usual. And I think we've got to understand that so long as one person remains infected, the whole country is at risk. because it's so easy to transmit this infection. I think China is beginning to fear a second wave, and this is something that has to be avoided at all costs. So, of course, they've closed down cinemas and they put in all the social distancing protocols to ensure they don't suffer a second wave. Now, the second thing I don't see happening is immune boosting. Okay, we need to boost people's immunity. We've seen and heard several times that vitamin C has been very, very instrumental to helping people get better, because as we all know, viruses can't really get killed, but the body has to fight the virus to survive it as it runs its course. And incidentally, we have well-researched herbal remedies that are both preventive and curative. And today, herbal research has gone beyond just the typical village unresearched herbalist. We have professors, like Professor Iwu, well-renowned, and Professor Kemi Odukoya from the College of Medicine in the Department of Pharmacology, University of Lagos, who have come out and said time and again that we have commonly available herbs that treat this, that can prevent and treat this contagion effectively. So how are we using them? We've heard about bitter cola, we've heard about pawpaw, we've heard about turmeric, ginger, garlic mixed with lemon and honey. Okay? And many people from around the world have sent videos showing us how this has helped. How are we boosting people's immunity? Especially as we know that we have the majority of Nigerians live in low-income, high-density areas where they don't have running water and social distancing is an impossibility because families live in cramped one-bedroom apartments, popularly known as face me, I face you. And so they even lack the first line of defense, which is hand washing and social distancing. So what do we do with these people? We definitely need to improve sanitation in these high-density, low-income neighborhoods by putting running water there. So everybody's running towards building isolation centers. But then, as we said before, that is reactionary. Why don't we prevent disease spread in the first place? Because if we build this isolation, if we build isolation centers and we don't also try to help people not get ill, we're going to be overwhelmed, like and experience what they had in Italy, where the healthcare system was overwhelmed and breaking down because there were too many people coming in. So we need to see how we can get running water to these areas, and also see how we can boost the sanitation facilities by putting more hygienically set up toilets and bathrooms so that the current inadequate facilities they have there, where several families use the same toilets and showers, can be reduced. So we reduce the points of contagion. And these are points of amplification. Keep in mind that apart from the fact that we should actually help these people stay healthy, every organization has cleaners, drivers, cooks who come from here. So you come from your Ikoyi and Victoria Island home where you've been self-isolating happily, you have sanitized everything around you, fumigated your house, and then you enter an office that has been cleaned by someone who's coming from the high-density, low-income neighborhood, has had no water to wash his hands as frequently as he or she should, has not been at social distance with anybody because they live in cramped facilities, and we're having all sense of security because we were detecting our temperature and they sanitize our hands before we enter the building. Okay, you want to go into your car and your driver who's going to drive you with the windows wound up is coming from that same facility. Then you want to go to have lunch in your in-house cafeteria or at a hotel or a restaurant, and the person cooking your food is coming from the same environment. So if we don't take care of sanitation in this environment, these are points of amplification, and they will spread to everyone. So much for your very safe ivory tower in Ikoyi, VI, or Lekki. Now, we definitely have to have a policy that makes it compulsory for social distancing protocols to happen and for everyone to wear face masks in public spaces. Because as we know, even those who are symptomatic without symptoms are not necessarily safe, which is why even in New Zealand, where they currently don't have any cases, they understand that they appear temporarily safe because many people who appear healthy now could, in the near future, begin to manifest symptoms. Now, we also have to reduce cash handling. And this is because cash is a strong medium of transmission. Cash passes through way too many hands not to be a high risk medium of transactions right now. And one way to reduce cash handling is to extend the palliatives from the government, the cash palliatives, through ATM cards or debit cards, whichever is easier for people to understand, so that people are compelled to learn how to use cards and get comfortable with it gradually. If you recall, I mean, this won't be easy, it won't happen immediately, but we've got to start so that we phase the use of cash off gradually. This is really, really important because if you put all the other things in place and then the cash you're holding infects, the cash we're holding infects us, then the whole purpose is defeated. So as you can see, we have to put a lot of strategies in place simultaneously. So I would also say we have to also find ways to ensure public transportation begins to operate based on cards or tickets but not cash. So we need to have public transportation safety policies. And this will also include having compulsory face masks before entering the form of public transportation and hand washing. We can do this by setting up wash hand basins at bus stops. So people wash their hands and sanitize and have their face masks on before getting into buses. It may sound difficult, but it's not so difficult. There are many innovations coming up right now. I recently saw an innovation in Ghana of someone who has a solar-powered sink that can easily be invested in and replicated so that those sinks are placed at every bus stop. So hand washing and sanitizing becomes a normal protocol before people get into these buses with their face masks and with their tickets. We don't need to reinvent the wheel. All these things are taking place. I think the public transportation system in Rwanda is already by card. And that's actually better for the bus owners because it reduces the possibility of pilferage and they're able to really make sure that they have all the money from the passengers going into the right accounts. So, but more important for this time, it's really to ensure public safety and that staff are safe by the time they go from their homes to their offices and back. The other thing I would say is testing is good. And I'll show you a video about what Senegal has done. They've invented a $1 testing kit. But again, it's not conclusive, as I said before. So for testing to be useful, retesting has to happen. And my thinking is that as schools, definitely schools are not going to go back now, but in the event that we start thinking about students going back, teachers and students will need to be tested and retested before reopening the schools or before being allowed to go into school, just so that we don't find ourselves in trouble. And this might also have to happen in organizations, but it's really important that we understand that retesting has to happen so that we don't move around with a false sense of security, infecting a lot of people. Now, what about the homeless? Remember, if one person has this disease, we're all at risk. We definitely need to create shelters for the homeless. Now, right now, all the public school students are at home. And this means that we probably can use the public schools as temporary shelters for the homeless, while jobs are created for engineering companies as well as architectural companies and construction companies by asking them to build low-cost shelters. And payment for this can happen by getting those who enter these shelters to work for them as employees. They can be trained and they can work for these construction companies in return for their shelters. And it's something that can be more explored and looked at, but definitely trade by barter has to happen when it comes to dealing with people who have no means of payments, and they can actually repay for what we have with labor. And this can be a temporary measure until other ways can be created to get them help them pay. Now, creating job opportunities is an inevitable measure because people need to be able to have money to be able to buy food, to stay healthy and not get sick. And there are quite a number of job creating opportunities coming up with this COVID pandemic. Um, Most African countries will have to achieve food sufficiency because most countries we were importing from before now have significantly reduced production and are saying what we have we're keeping for ourselves. So Africa and Nigeria need to ramp up their food production, and this creates opportunities for jobs. The agribusiness value chain has opportunities for jobs at every point. So you go from farming to processing, to packaging, to warehousing, to distribution. And each of these points provides a lot of opportunities for jobs to be created. And right now, we have a lot of able-bodied young men just hanging around and waiting for palliatives to arrive while they could be put to work and ensure that food sufficiency is achieved within record time. So, of course, this has to come from a Lagos state or federal policy where arable land is portioned out, cleared, and these people are trained in agribusiness. But when I say this, many people argue that area boys don't want to work, they want to extort. The point is this: for every problem, there is a solution. There's a way to reach these boys. Every area boy belongs to a gang, and every gang has a leader. And I think that what we need to do is to talk to these leaders and help them see what the potential is. Because if they know that that everything they produce will be purchased, there's an incentive for them to produce a lot, because if they produce only 5 bags of rice, for example, only 5 bags will be bought from them. If they produce 10 or 20, the 10 or 20 will be bought from them. So that should be an incentive to make them want to produce even more, as much as possible. And of course, while they're doing this, they're paid a daily stipend, which can be deducted from the total amount that they will be given in payment for their production at the end of the period. But what can't happen is that we have manpower idle when there's work to be done in terms of food sufficiency. Now, the construction industry also provides a lot of job opportunities at a time like this. So let's take, for example, the fact that Lagos gets flooded every year, which means that there needs to be a significant restructuring of the drainage system in the whole city. This is a time when engineering companies can be engaged to take care of the drainages in different parts of Lagos State. Now, to do this, you need to employ people. Again, the same strategy. Who are the leaders of these people in various parts? I mean, the 1 million or boys who have been going around trying to, burgle houses to find food, have leaders. Those leaders need to be helped to buy into this. And once they buy into this, they get their boys to buy into it. And we can take care of these drainage systems. Again, look at our markets. Our markets have open markets like Mile 12, Idumota, Akpogbo, name it, Mushi Market, all our open markets are in a state of huge disrepair. This is the best time to restructure them, get them to be more sane locations for shopping. And these companies can get paid by tolling at the gate. So we can have a build, operate, and transfer system that ensures that the people who invest in getting this done while creating jobs can also recoup their investments and the returns on their investment by tolling customers who come into these markets till they recoup their capital investment as well as their interest, the return on these investments. Okay, IT. There's so many things for IT geeks to come up with right now. Solutions for different problems. Okay, because for many businesses to exist, they all have to go digital, and so IT buffs have a lot of opportunities right now to create solutions that will help many businesses pivot from where they are to where they need to be able to survive with the new normal. So we are in a marathon, not a sprint. Business as usual will most likely never be the same again. It cannot continue. And life will change as it has for travelers. I mean, we're all now used to not having liquids, taking off our shoes. It didn't used to be the case, but now it's a normal thing for all of us, and we take it as normal. Similarly, these standards of hygiene will need to be in place for at least 2 years, and after 2 years, most likely it's going to be the normal way of acting. So my belief is that if we're able to put these various strategies in place ahead of lifting the lockdown, we will be in a safer place. We can then learn to live with this virus while progressing the economy without while minimizing infection. I'm just going to show you the picture of the solar powered sink. Okay. There's another, I couldn't find an image for it, but there's another sink that is foot pedaled where you can get your liquid soap out using the foot pedal, and also get water to come out from the tap using the foot pedal. And these are local African inventions. Now, if people are looking for how to make money, these are the kind of inventions we need to invest in to get them produced in a more sophisticated or trendy manner. And you'll be sure to have a lot of customers, because organizations will need to have these sort of things outside their door, so that before anybody goes in, they wash their hands and before they sanitize. We've all seen and heard that sanitizers alone are not as effective as hand washing. So if you really want to make sure that anybody entering our buildings, whether it's a school or an office building or our homes, are really coming in without introducing viruses, we need to make it easy for people to wash their hands, okay, sanitize, have their face masks on before they go into the building, because as I said before, checking the temperature is not conclusive. Many people are symptomatic, and with that false sense of security can actually go around, be a more dangerous means of transmission. I wanted to also share this with you. Professor Olukoya of the University of Lagos published an article in the newspaper last week, Wednesday, I believe. That is the link. And she spoke about herbal remedies that she has researched and says that they work. One of them is pawpaw. She says that if you boil pawpaw leaves and you take a cup in the morning and in the night, you have this ailment, you get infected, it works. This is also preventive. I guess you probably take less as a preventive measure. And then she also spoke about how you combine turmeric, garlic, ginger with pepper and uziza, which is a very common herb for the soup and other traditional soups. And with that combination, she says, you get well. So she's put this is not a fly-by-night person. She's a renowned professor of pharmacy at the University of Lagos under the Department of Pharmacy. She can be checked out. This article was published in The Guardian. And I think that the sooner we begin to publish our local remedies, the better for us, because the whole world today is talking about Madagascar. What is making Madagascar be able to lift the lockdown safely is a herbal remedy. Now, I don't know if this is true, but I saw on Twitter that the SGF of Nigeria, the Secretary of the SGF, is thinking of going to import the Madagascar herbal solution. And I'm thinking, why are you going to Madagascar to import a solution when it's right here in our backyards? We have many things here that work. Professor Ewu has spoken about bitter kola, okay, and the garlic ginger solution has been videoed by many people abroad, both in the US and the UK, to tell us that they got better at home using this. I'm not a doctor. I'm not saying this is foolproof, but these are things that we normally consume and we know that they are healthy. So if it works, why don't we try it? And if it doesn't work, then we continue with all the other things that the isolation centers have the doctors that can also give alternative treatment. Each person is different things work for different people. But the point is, we've got to agree as a country what works and at least boost the immunity of the people, since we can't test them adequately. Now, I wanted to quickly share the video. I mean, it's been going around. I've seen that about 7 times on WhatsApp, but just in case people here haven't seen the video, I'd just like to quickly share that with you, and then we'll stop for questions and answers after that. I'll just go to share screen and come up with the video.
Not just the Western world that has the scientific know-how to beat the virus. In Senegal, a laboratory has used its AIDS and Ebola experience to develop a $1 COVID-19 testing kit. Al Jazeera's Nicholas Hawk has more.
Senegal is doing what most countries can't, testing everyone, symptoms or not, entering a health center for the novel coronavirus. It has no shortage of testing kit thanks to this lab at the Institut Pasteur. Researchers are developing a $1 quick diagnostic kit, originally made to test for dengue fever. Patients drop blood or saliva onto the devices and wait for bloodline to appear, like a pregnancy test, explains researcher Amadou Sal.
There is no need for a highly equipped lab. It's a simple test that can be done anywhere. The idea is to rapidly produce 2 to 4 million kits, not just for us, but for African countries, so that we can detect and isolate patients quickly.
The sick are administered a cheap anti-malarial drug called chloroquine, commonly found in sub-Saharan Africa, where malaria is endemic. With only 50 ventilator machines for 16 million people, Senegalese engineers are using a 3D printing machine to produce more. While imported ventilators cost $16,000, this one is just $60. Senegal is counting the cost, and it's paying off. More than a month into the outbreak, the small West African nation suffered only 2 deaths, with most patients treated healed. Senegal has the largest rate of recovery in patients infected with the coronavirus in Africa, the 3rd in the world, ahead of countries like the United States and France. And while it has a tiny health budget compared to those countries, it has a wealth of experience in dealing with infectious diseases and outbreaks.
Right. So as I said before, I'll just come back to the slides. As I said before, the objective of this, oh dear, just come back. Okay. Of this seminar is to help us understand how we can achieve health safety and economic progress when the lockdown is lifted. So my belief is that if we're able to put in place these various suggested measures, we should be able to lift the lockdown and ensure that we can operate in a safe way. I strongly believe that Africa can actually be the one showing the rest of the world how to deal with this. Obviously, it will take a while for the rest of the world to accept the fact that they have to learn from Africa, but I think we have all the aces if we will only believe more in ourselves and apply our local remedies, herbal remedies that have been tested and dosified, as most of our professors of pharmacognosy have been telling us. Thank you very much. So I think I'll hand over back to Efosa and take the different questions that you may have. Thank you, Efosa.
Okay, thank you, Dr. Henrietta. We have a few questions here. I'll start with the first one. He says, "Dear Madam, I have just started my own law practice. I have not started making money now or even before COVID. I have always enjoyed telling people to start doing what they like in terms of the job they do. Since I cannot say I have succeeded, I feel I'm not qualified to tell others how to start what they like. What do I do?"
Sorry, he hasn't had his law practice, and
yes.
What he wants to do
is practice. He's not been profitable. And he says that, what should he do now?
Okay, so that's a question that's out of the scope of this particular webinar. I have another webinar coming up on May 7th where I talk with entrepreneurs about survival strategies during COVID-19. So can we keep that question for them so that we don't digress from the objective of this seminar, if you don't mind, with all due respect?
So thank you. The next question is, do you have an idea what the federal government is doing concerning the herbal vaccine that was discovered in Madagascar? I would like to know.
Yeah, so as I mentioned, what I do know is that they're thinking of, it's not a herbal vaccine, it's a herbal drink. And I actually have a video of the president talking about it. It's not a vaccine. It's like our bitter cola, or what Professor Odukoya is saying about pawpaw. You know, she says, it's either you blend the unripe pawpaw or you boil the leaves and take a cup in the morning and in the evening. So it's a herbal drink. It's a plant. Okay, so they're thinking of importing it. But my point is this. If you have what works in your country, why do you want to import? Okay, why don't you test this thing, we have NAFDAC, okay? There are ways to test what works. So this lady is not a fly-by-night. She's a professor of pharmacognosy. Professor Onwu is also a renowned scientist. Even Americans reached out to him months before now, so because they're working on a cure. So let's use what we have to get what we want. We don't need to go to Madagascar, because nature, what nature does, as I've heard from many people who are into herbal medicine, is that it puts what you need. And what you need is what is best for you in your own environment. Why ignore what is working here and go to Madagascar? So yeah, they're thinking about importing it, but I hope they don't go ahead with it. Personal opinion.
Thank you. The next question is on the issue of cash handling. Is it possible for banks to decontaminate cash received before paying them out? Considering our peculiar environment, we are very cash handy.
Yes.
How can we do this, and how can we even encourage our banks to do something about this?
So it's all about creating incentives. I recall when it was time, when we're trying to make Nigerians use seatbelts, it was almost like an impossible task. But today it's normal because people paid fines and all of that. So it's on one hand putting incentives in place to motivate people to facilitate behavioral change. On the other hand, also put punitive measures in place for those who don't comply. Now, but the most important thing is information, to understand why there's a need for that transition. So cash doesn't come to you from the bank directly. Cash passes through millions of hands before it goes to the bank and back to you. So if you understand, I already knew. In fact, there's many supermarkets around that don't accept cash anymore. So it's common. If you just think about it, you don't need to be a doctor to know that if social distancing is required, that cash can be a strong medium of infection. So if you understand that, then we will all work towards a gradual movement. Okay, we all use ATMs now. I recall when the ATMs were about to come into Nigeria in 2002, 2003. Most people said it's impossible. It can't work in Nigeria. It's something that happens abroad. But today it's a norm for all of us. Okay. Similarly, we will all gradually, even get to prefer to have a card rather than cash. But the point is, for the sake of our health, we just have to accelerate that transition. Okay. Government is giving out cash palliatives. Don't give it out in cash. Give it out in a card. And then let's see. Of course, when you go to the ATMs, you also have to be very careful, okay, about wiping before you press any button and use. So maybe ATMs will also need to have disinfectant wipes that people use to wipe before they press and before they and get their cash. But the point is, or POS, people will use POS, so you don't need to go to an ATM to get cash out. Sorry, I'm even going back to the old method. But the point is, we need to accelerate that transition now if you want to remain safe. Otherwise, what's the point of social distancing when you're going to be touching 10,000 millions of people through the money you're holding? Just doesn't make sense.
Okay, thank you so much. Now, the next question is, what do you consider to be the most important lesson we've learned as a nation from the pandemic? Have we learned? Are we learning? And what are we going to do in the future?
Well, I hope we're learning. I hope we're learning because as we all know, they were thinking of renovating the National Assembly while we don't have hospitals, and a lot of money has been put into the healthcare sector, but it has been not been appropriately managed. So I think that now that we have no hospitals to go to, there are no flights, countries are not accepting people from other countries for fear of disease transmission, and even those countries are worse off right now. So I can't imagine anybody saying, I want to fly out to the UK or the US for any treatment. So now that we have to be self-sufficient, I'm hoping that we would have understood and learned the importance of making sure we have a world-class health system. Nigeria has had so many bad habits because the amount of money we spent on air ambulances and payments for treatments abroad is enough to set up at least 10 world-class hospitals in Nigeria. So I really hope that this pandemic, they say under every cloud there's a silver lining, teaches us the importance of making those world-class healthcare centers in our country.
Thank you. The next question is, my concern really post-COVID is having to go out to our local markets and other public places. What do you say? My fear post-COVID is having to go to our local markets and public places. In my opinion, the government isn't doing enough to keep us safe.
Yes.
Now, what do you think we can do as citizens? I don't have a lot of money, so I cannot promise to build taps in the markets. I can't promise that the market woman there is health conscious and is washing her hands while attending to me. What can we do?
Okay, so to answer this question, I want to just share this slide, which I think is very informative for everybody. Okay, I hope, yeah. So if you can see this slide, it says, just to buttress the point of this question, it says the most severe pandemic in history was the Spanish flu of 1918. It lasted for 2 years in 3 waves, with 500 million people infected and 50 million deaths. Most of the fatalities happened in the second wave. The people felt so bad about the quarantine and social distancing measures that when they were first lifted, the people rejoiced in the streets with abandon. In the coming weeks, the second wave occurred with tens of millions dead. Let's not repeat history in the time of COVID-19. So your fear is I share your fear. Okay, going back to the question of the person who says, yes, I fear that we're not yet ready for lockdown to be lifted, but that we can work towards safely lifting the lockdown, okay? There are not enough things in place at all for lockdown to be lifted. And that's really the reason I wanted to have this webinar, to hear from you, to learn from you, and also to share my suggestions as to what needs to be done for us to remain safe. So I think the best bet is for each one to fortify themselves, okay? I was speaking with a friend yesterday and he was saying, I also have my immunity brew. In fact, my house will have a weight of we call it the immunity brew. So the ginger, garlic, turmeric if you want, lemon, honey combination, the hot drink every day without fail. Just make sure you have it. So because really it's difficult. You're right. How do you know the market woman doesn't have it? Actually, but you have to buy vegetables from her if you want to remain healthy and all of that. So I think immunity boosting is really the way forward. Okay. As a doctor said to me some time ago, we are in the world of germs. The world belongs to bacteria and viruses. We are the intruders. So we've got to find a way to live with it. And that's really the truth. If this is a marathon, because it's going to take us at least 2 years, I mean, maybe 1.5 years if we're lucky, but let's just safely say 2 years to be able to, I don't know if we can even get rid of it. I mean, think about it. One person is infected and the rest of us are at risk. Can we really get everybody uninfected? I don't think vaccines are the way forward for this thing, because there's a flu vaccine, but people still get the flu, okay? I would rather say, let's learn to stay healthy, even in spite of the fact that this thing is around. And our herbal remedies do the trick. Thank you. Next question, please.
Okay, thank you. The next question, he said, thank you for an insightful presentation. He said, are you aware of the trending video of the governor of Cross River State on how Nigeria should respond to COVID-19? What are your thoughts, please?
So I've seen 2 videos about the governor, and he spoke about developing vaccines. Vaccines is one way to go about things. Yes, we've done vaccines. Many countries in the world are doing vaccines. Israel says their vaccine should be ready by June if we're lucky. That's one way to go. But to be honest with you, I don't intend to take anybody's vaccine. I'd rather go for the herbal remedies, which have always kept us safe. And we know that people have been saying that we've been with it. Many doctors have said this thing has been in Nigeria since December. I mean, December, January, February, March, April, okay? What has kept us going? Many who have said, I think I've had this thing because I've had a strange kind of fever and I got over it. Now, if you listen to what I said about what Professor Odukoya said was a remedy, was one of the several remedies. She said ginger, garlic, pepper, which is something that all Nigerians eat, and uziza, the combination, okay, with lemon and honey. Nigerians eat pepper. For all you know, pepper is already helping you overcome it. Uziza is a very common herb, okay? So I just think that we need to know what works, okay? They say bitter cola 1 a day for preventive uses. Another person has said, oh, he ate 4 for 4 days and he got it, took 4 bitter cola, ate 4 bitter colas and in 2 days he was fine. So there are things that are working. Let's talk to the experts. I'm not a doctor, I'm not a paramedic, but I'm listening and I'm reading and I'm seeing what is working, okay? Even Africans in the UK and the US have told us what they took and they got well without going to the hospital. So I don't know why we're doubting ourselves. I don't know whether we want people who are dying in thousands to tell us who are not dying in thousands what to do. Okay, so I think that we can try. It doesn't kill you. It's food anyway. People have been eating bitter cola forever and they haven't died. I'm not recommending even chloroquine. I'm not a doctor. I have the right to do that and I won't do it. But these are natural things that are working. So I think that's the safest way to go. I saw 2 videos on the governor of Rivers State, and I actually praise what he's doing. And that's one way to go about vaccine, but I don't think it's as simple as that, to be honest with you. I think we need to be a bit more careful when it comes to all those things. But I am a bit more daring when it comes to applying herbal treatments that are already consumed as food, because I think there's nothing to lose. I think it's safe to try. Next question, please.
Thank you. The next question is, I work in a chauffeur service company. We're barely making money due to the pandemic. What measure can we take this period to ensure our survival based on the different tips they're giving us? Specifically for our chauffeur service, what kind of measures should we be taking right now?
Well, so chauffeur service, that's a very high risk job at a time like this. I think that both the person being chauffeured and you, the chauffeur, have to protect yourself by 1, wearing face masks, 2, making sure that the AC vent is on open. You know, you can always have your AC circulating air within or getting open air coming. Better still, just wind down, okay, if it's not too hot. Well, for security reasons, so disinfect, wear your face masks, make sure the AC is on open, and boost your immunity. You can also, so boost your immunity because you, the chauffeur, has a higher risk because you drive different customers. Your customer will come out of your car after being driven by you, but you will have a constant stream of customers. So you need to boost your immunity. Make sure you're wearing your face mask and you're changing them as frequently as you should. I hear that face masks must be changed every 8 hours. Careful, everybody's not making face masks. Make sure you have the one that really works. You know how to test it. You light a flame and try to blow it out. If you can blow out the flame through your face mask, then it is not working. Okay, there are fabrics that are good and there are fabrics that are not, and are useless, that don't give you any protection. So make sure you have the right type of face mask and that you have it on always, and that as much as possible, you open your window just a little bit for fresh air to come in. Your AC vent is on open, and I think that's the safest you can do. And of course, sanitize your door handles as frequently as possible, and if possible, your chair. So you might need to even get disposable seat covers. That's another opportunity for business. Even I'm not talking about business right now, but that might help so that each time you have a new passenger, when they see you changing the seat cover, they feel, oh wow, what's your number? I want to call you time I want to go out. And that can actually give you a competitive advantage because they can see you're taking all the measures in place. You wear gloves, okay? If you want, you can also offer them sanitizers and gloves. And if they don't come with a face mask, you offer them a face mask. So the more safety precautions you put in place to inspire a sense of, hygiene in your taxi, the more likely you have to have more customers, because customers are just as scared as you, but they may have no choice but to still call Ubers or Taxifys or Bolts to help them get to their destinations. Yes.
Thank you. The next question we have here is, shouldn't the government be encouraging telcos to introduce mobile money apps? This will help reduce the use of cash in society. I don't know if cash has been established as a form of transmission, but if it has, then shouldn't this be the best approach?
Okay, so do you need anybody to tell you that cash is a form of transmission if you know that social distancing is important? Because it's just the same principle, okay? So if touching people, why are we not shaking hands and hugging as before? So everybody's holding cash. So cash is even worse than shaking one person or hugging 10 people, because cash has gone through millions of hands. So yes, it is a medium of transmission. And then we already have a lot of mobile money apps, but hey, more can be developed, which is why I said IT geeks have an opportunity right now. This is their time to make a lot of money from creative solutions that are relevant to solving problems or helping people stay safe. Yes.
Thank you. The next question we have here has to do with land. He said, I believe Nigeria has to ramp up food production to achieve self-sufficiency at this time. However, one of the major impediments is the Land Use Act. Large-scale food production cannot be achieved without large-scale commercial agriculture. This cannot happen without repealing or modifying the present act. What do you think?
I'm so sorry, I got distracted reading one of the questions, but please take it again. One last.
Okay, take it again. I agree that Nigeria has to ramp up food production to achieve self-sufficiency at this time. However, one of the major impediments is the Land Use Act. Large-scale food production cannot be achieved without large-scale commercial agriculture. This cannot happen without repairing, modifying, or reenacting the Land Use Act. What do you think?
So I agree with you, but I will also say to you, please try to consciously overcome that tendency we all have of only seeing what the problems are. There are so many Nigerians with huge farms right now, okay? What I'm even advocating is for the government to be the one even inviting people. You know, I have land, okay? If you're ready to work, they'll have some few requirements. They will give you the land because they want you to produce and they're promising to buy everything you produce, okay? So there is absolutely nothing in this world that comes easy, whether in Nigeria or anywhere in the world. It is so important for us to have this mindset of resilience and overcoming challenges. Nothing is going to come on a platter of gold, okay? I agree, Nigeria's Land Use Act needs to be revised, but while it is still there, let's do what we can, okay? And then don't also forget that when you talk about agriculture and farming is not the only thing you can do. You can, in fact, I will advise people who are not used to farming to stay away from it because you can also lose a lot of money there. There's processing that gives a lot of money. There's packaging. There's warehousing because 40 to 50% of what we produce gets wasted because we don't have enough processing and warehousing facilities. So we can focus there, okay? And then of course, retailing to the end user. Those areas tend to have a higher margin than even the farmers. So look for opportunities. Find ways to make things work. And I assure you that life is not easy, it's not much easier anywhere in the world. Okay, I've lived abroad. It has its own challenges too. So Nigeria has its own challenges. So just find ways to make things work. Okay, but it's a natural human tendency. I talk to myself too. So you see a challenge, I say to myself, for every problem there's a solution. What's the solution? And I go for it. And sometimes it won't be easy, but we must be resilient until we get a result. Yes. Next question, please.
Okay, thank you. In my office, we have shared facilities, and I believe that is also an avenue for spreading the infection. Even though we wash our hands and we sanitize when we enter the building, how will a company combat something like this?
So definitely, given what we have on ground, offices will need to restructure. But again, as I said before, boost your immunity, because even with all the hand washing and face masks and social distancing, this thing can be in the air, okay? You're not there when the cleaner comes to clean, so you don't know whether she has her face mask on or not. So she could have left a generous supply in the air. But if your immunity is boosted, you're eating well, you're exercising, you are going to be fine. I mean, the chances of you being knocked down is much less. And even if you're knocked down, the chances of recovery are very high because all you need to do is just ramp up your immunity brew, make it more concentrated. I mean, either make it more concentrated or take it more than once a day, and you'll recover. Remember, it's not about boosting your immunity to fight this virus. Okay, so boost your immunity. It will solve a lot of problems, and of course, still put the other precautions in place. Wear your face mask, sanitize your hands, and be careful. But a lot of offices are going to be required to make sure they rearrange. And again, I don't think it's likely that people are going to all go back to work as usual. Working from home, someone has even coined WFH as the acronym, for working from home, will become the new normal. So maybe some people will resume and others will work from home going forward.
Thank you. I have one more question here. He says, all these strategies are excellent, thank you, but we are just citizens. The government is receiving palliatives from the federal government, state governments are receiving monies from donors. Why then are we expected to have to spend our own money when government isn't doing anything? How do we ensure and mandate government to do the right things? You've mentioned markets, public places, bus stops. All these places are high places where the virus can strike. Decontaminating is not the only option. We're looking at different countries like Kenya, who have hand washing facilities at their bus stops. As you step down from buses, you are washing your hands, you are sanitizing before you move on, even before you get on the buses. How do we make our state governments do the right thing?
So I agree with you, and that's one of the reasons why this webinar is going on. I've written the article. I think it should be out today in The Guardian, if not today, sometime this week, about this. I've also shared it with various people I believe can help to get it to government. As citizens, this is the best we can do. Advocate, share our thoughts, also learn from the government. I don't know what to say, but I also wish that more will be done. The government is trying, and then let's also keep in mind that government has no money at this point in time because oil, which is our main source of revenue, has gone. I personally am not unhappy that oil has gone because we have so many other ways to earn very good foreign exchange, which we ignore because we're all looking at oil. So finally, Nigeria is going to be compelled to diversify the economy. I see it as a good thing in a sense, because I recall also that during the last 2016 recession, suddenly the number of Nigerian-made products in supermarkets increased. Before then, foreign goods were 95% what was sold in supermarkets. Today, roughly 30% or more of Nigerian-made goods are sold in our supermarkets because during the recession, people couldn't get the foreign exchange to import things we could produce ourselves. So I'm hoping the same thing happens with this pandemic, that we're forced to improve our healthcare system and we're forced to do many more things for ourselves. Okay, and yeah, thank you.
Okay, thank you. So that's all the questions we have. Other questions have to do more with strategies for entrepreneurs, how to manage during this pandemic. So what
we'll talk about that on the 7th of May. Well, there are many questions on the chat, in the chats. I don't know if you've looked in the chats.
Yes, a number of them have posted it on the Q&A aspect.
Okay.
I just comment about what you're talking about.
Okay. All right. So
there's one person here that asks you to please recap some exit strategies you discussed earlier, but I had a bit of network issues.
Okay, so I can quickly go to the screen and just quickly, let me share screen. Okay, so basically what we spoke about at the beginning, well, so the first thing is to understand the objective of this webinar, which is how we can live with the new reality while maintaining health, safety, and achieving economic progress. And so we looked at the different things that measures have been put in place to reduce disease spread: lockdowns, testing, building isolation centers, improvements on public hospital facilities, treatments, decontamination and fumigation. And we saw that they were not quite, they were good, but not so effective. So lockdowns slow down infection, but they're unsustainable. Testing is not conclusive because you can be reinfected. Building isolation centers is reactionary because we can get overwhelmed. Improving hospital facilities, reactionary but good. Treatment is good, but people can be reinfected. Decontamination is good, preventive but not foolproof because it just reduces contamination. And so we then said what will work, and we said information dissemination about the virus and how to prevent its spread to facilitate behavioral change. Boosting immunity, I think this is the real key. Boosting immunity, either through using vitamin C or well-researched local herbal remedies. Improving sanitation in high-density, low-income neighborhoods, okay, where they need to, because we say hand washing and social distancing are the first lines of protection. In this place, there's no running water. How do they wash their hands? How do they social distance? So we need to improve sanitation in these areas. Maintain social distancing protocols and have a policy on face masks. Make it compulsory for there to be no social gatherings and for everybody to always have face masks on. We thought about reducing cash handling because cash is a medium of transmission. If we're saying maintain social distancing protocols, cash is equivalent to shaking 1 million people at a time, and therefore is a disease transmission medium. Okay, so we need to ensure that that is eliminated and substituted for card usage. Public transportation safety policy. So here we talked about hand washing and sanitizing before you get on buses. And as somebody suggested, also when you get off the bus, do the same. And this is good for, this should be done for both public transportation as well as entering public buildings. Before you enter any public building, there should be something, a place for you to wash your hands, sanitize before you enter the building, and of course, have your face mask on. We spoke about the fact that testing is not conclusive. So for testing to be useful, retesting has to happen, because you can test negative today and be positive even by the end of that same day, talk less of the next day. So we need to keep retesting, and this will be something that's required for schools to reopen, for teachers and students to be both tested and retested periodically. And then we talked about creating shelters for homeless people, keeping in mind that even if only one person is infected, the rest of us are at risk. So if we shelter these homeless people in temporary shelters, and we suggested that you can use public schools that are currently not in use to shelter these people while getting shelters ready for them in such a way that they can exchange accommodation for, labor, for example, we also keep them safe. This is one disease that will help us understand that we need to be our brother's keeper, because if we're not, we will pay the price almost immediately. Okay? If even one beggar on the street has this disease, we are all at risk. So we must take care of everybody. And then we talk about creating job opportunities, which I will speak more about in the webinar we have on on the 7th of May, where we talk about surviving and thriving, how to help entrepreneurs survive and thrive during and beyond COVID-19. Right, so the time for this webinar is up. I'd like to thank all of you for being here. For your questions. I'm going to look at them and see if I can answer them later on if you have your contacts there. I hope this has been useful. I hope you can also help with transmitting this to people who are in authority and can actually contribute to shaping national policies to ensure that as we work towards lifting the lockdown, we still remain safe and we don't experience a second or an even third wave of this pandemic. Thank you all for being with us. We'll be happy to have your feedback as to how to keep improving the webinars. Take care and have a lovely day. Efosa, back to you.
Thank you, everyone. We're grateful that you joined us today. The slides and the video will be sent to you later on this week. Thank you so much. Have a lovely day and stay safe.
Thank you.